Your doctor handed you a prescription for prednisone and said, "This will help your pain." And it did. Within days, you felt like a new person. The pain melted away, the inflammation calmed down, and you wanted to hug your doctor. But then the side effects started: the weight gain, the mood swings, the insomnia, the bruising, and nobody warned you. I'm Dr. Diana Girnita, a board-certified rheumatologist, and in this video, I will tell you the truth about prednisone and the 10 side effects that every patient must know. So stay with me, because what you are going to learn here could save your bones, your eyes, and even your life. Let me tell you something that most patients do not realize. Prednisone is a double-edged sword. On one hand, it is the most powerful anti-inflammatory drug that we have. Cortisone was discovered in the 1930s, and doctors who first used it won the Nobel Prize in 1950. And it works fast, and it works strong. And prednisone is my best friend in rheumatology. But this is critical. If it's used inappropriately for too long, prednisone can cause more side effects than almost any drug that we prescribe. And every week in my clinic, I see patients on prednisone for years who were never warned about what is coming. Here are the 10 side effects that every patient must know. Number 1, diabetes. This is the most underestimated side effect. Prednisone will raise your blood sugar. Patients that stay on high doses of steroids can develop insulin resistance and eventually full diabetes. If you have already diabetes, then prednisone makes it dramatically worse. And my advice, if you are on prednisone for more than a few weeks, then you should ask your doctor to check your hemoglobin A1C and the fasting glucose. Number 2, weight gain. Now pay attention to this. Prednisone makes you hungry, constantly hungry. It changes how your body stores the fat. And typically on your face, on your belly, and your upper back, you're going to see those changes. Patients can gain 10, 20, and even 30 pounds in just a few months. And in my practice, I tell every patient, while you are on prednisone, you eliminate sugar. You will limit bread, pasta, white rice, because the hunger is the drug, not your willpower. Number 3, osteoporosis or bone loss. This is one of the most serious long-term complications. Prednisone directly causes bone loss. Even at low doses, long-term use can thin your bones. An easy fall can also cause a hip fracture or a vertebral compression fracture. And from there, you can end up with months of disability, with chronic pain, and sometimes with death from the complications. So my advice, if you are on prednisone for more than 3 months, you need to have a bone density scan or a DEXA scan. And you should take calcium and vitamin D to prevent osteoporosis. And sometimes you might need osteoporosis medication. Number 4, osteonecrosis, which is the death of the bone tissue. Osteonecrosis is different from osteoporosis, and it's worse. Osteonecrosis, it's also called avascular necrosis because it happens when the blood flow to a bone is cut off and the bone dies and the joint collapses. So patients, they do need joint replacements. And it can happen at any prednisone dose and at any time, but most often it happens after many years of using prednisone. The most common joints affected are the hips, the knees, and the shoulders. And this is important. If you develop sudden, severe joint pain while you are taking prednisone, you need to check it immediately. Number 5, cataracts and glaucoma. Now be careful, because prednisone can affect your eyes. Even at low doses, 10 milligrams every day, over a long period of time, that can cause cataracts, which is the clouding of the lens. And it can cause glaucoma, which will increase the pressure in your eyes, and it could damage the optic nerve. And both of these complications can cause vision loss. So my advice, if you take prednisone for a very long period of time, you should see an ophthalmologist, an eye doctor every year, because you need to catch these problems early. Number 6, bruising and slow wound healing. You have to know that patients on long-term prednisone may develop thin and fragile skin. Now, even minor bumps can cause large purple bruises. Now, a small cut can take you weeks to heal. And this is because prednisone breaks down the collagen, which is the protein that gives your skin strength. Now, my advice is to be gentle to your skin. Wear long sleeves, for example, and be careful with any cuts. Number 7, increased infection risk. Now, this is critical because higher doses of prednisone, typically above 20 milligrams every day, it will significantly suppress your immune system. And you can become vulnerable to tuberculosis, to candida, staph infection, CMV infection reactivation, shingles, or herpes zoster. And if you take high doses of prednisone for very long periods of time, you may develop shingles. So be careful. Talk to your doctor about getting vaccinated, including with the Shingrix vaccine. Number 8, high blood pressure. Prednisone will cause your body to retain salt and water, and that will increase the volume in your blood vessels, which will raise your blood pressure. So my advice, while you take prednisone, try to reduce your salt intake. Monitor your blood pressure at home, and talk to your doctor if you see a blood pressure increase. But never stop prednisone abruptly, because stopping abruptly can be life-threatening. Number 9, mood changes, anxiety, depression, and even psychosis. Now, this is one of the most overlooked side effects. I've seen it in patients. Prednisone affects the brain. It will change how your neurotransmitters like serotonin and dopamine will work. And many patients will report anxiety, panic attacks, insomnia, mood swings. They are happy one day and then they are depressed the next day. It could cause irritability and pressure speech, and in rare cases, full-blown psychosis. So if you are on prednisone and you feel that you are no longer yourself, it is the drug. It is not you. And my advice, take your daily dose in the morning, because prednisone or steroids, they need to mimic your natural body secretion of cortisol. And in this way, you can reduce the symptoms and especially insomnia. And if you have mood changes that are severe, then talk to your doctor to help you. Number 10, peptic ulcers and gastrointestinal bleeding. This is dangerous. High doses of prednisone, especially when combined with NSAIDs like ibuprofen, they can cause stomach ulcers, and they can even cause severe gastrointestinal bleeding. So pay attention to your stool. If you see dark, tarry stools, or if you see bright red stools, that is a medical emergency. So call your doctor or go to the emergency room immediately. Now, let me tell you a story about one of my patients. A 67-year-old woman came to my practice, and she has been on prednisone 20 milligrams every day for 4 years. And that was prescribed by her primary care physician for joint pain. And for these 4 years, nobody reassessed her. When she came to me, she has already gained 35 pounds. Her blood sugar was high, and she had 2 compression fractures of the spine, and she already lost 2 inches of her height. She had cataracts developing, and she was never diagnosed formally with anything, just arthritis. But actually, she had rheumatoid arthritis. We assessed everything and we changed the treatment, and she started after a short period of time on methotrexate. And then we slowly taper her off the prednisone. We added vitamin D, we added bone protection medication, and within 12 months, she was completely off prednisone. And this is what I do. Yes, prednisone is a powerful tool, but it must be a bridge, not a destination. If you have been on prednisone for more than 3 or 4 months, here is what most patients do wrong. They keep taking it. They don't stop it. And most of them, because they see the doctors every 4 months, they don't get reassessed. And in this way, they lose the bone, they develop diabetes, they gain weight, all because nobody will adjust their plan. Unfortunately, this is the traditional path in the traditional system, and it is broken. A doctor will prescribe you prednisone, nobody reassesses you, you have difficulties to see a rheumatologist, and that's why I have built Rheumatologist on Call. Because when you work with us, you see a board-certified rheumatologist in a few days, not months. You have access on telehealth across 20 states. You don't need a referral. You have a full hour for your first visits. We review your prednisone dose, the duration, the side effects, and we figure out what is the underlying disease. And in this way, we can build a taper plan that we will follow, and we will get you off the prednisone. So in this way, you will get the right long-term treatment that doesn't require you to take prednisone every single day. I built this practice because too many patients that I've seen after many years, they were on prednisone and they suffered unnecessary consequences. And in my book, Thriving with Rheumatoid Arthritis, which you can find on Amazon, I dedicate an entire section to corticosteroids. So the link to this book and the link to make an appointment with us is in the description of this video. Knowing the side effects is only step one. But if you stop here, you're not going to find out about the better long-term options that might wait for you. So watch this video to learn about the powerful biologic medications that can replace chronic use of steroids and can protect your bones, your eyes, and your future. And if you found this video helpful, subscribe to my channel, because here you're going to find evidence-based information from a rheumatologist who tells you the truth.